Well, I mean, the mind is actually the most important sex organ.
Well, if that's true, then can the mind help cure erectile dysfunction? Hey guys, it's Kevin Francis here from Man Up Malaysia, and in this episode, we'll be exploring the link between mental health and erectile dysfunction. So, if you're experiencing some sort of erectile dysfunction and you're wondering if that's psychological, well, we'll find out more with my special guest today. He's a consultant psychiatrist and addiction specialist, presently a professor at the Clinical School of the International Medical University and an honorary consultant psychiatrist at Hospital Tuanku Jaffa, Seremban. He's also a visiting consultant psychiatrist at Asunta Hospital and the Mind Faculty in Mont Kiara, Kuala Lumpur. If you're ready, it's time to man up with Dr. Philip George. Hey, Dr. Phil, thank you for being on the show. I wanted to title the show Think and Grow Big, just a play on the motivational book Think and Grow Rich. But seriously, is it as simple as that to get an erection?
Well, I mean, the mind is actually the most important sex organ. We often fail to realize that actually 70% of intimacy is really related to the one organ, which is the mind. And the other 30% is, your genitals and, maybe some of the other things that you find erotic or, sensuous. But really, the mind is the main organ behind, good sexual function. You have to be in the right frame of mind, and that's reliant on many different factors, your underlying factors, as well as, your current issues, or, if you have an illness and that interferes with your, mental health and also, or even your physical health, then that can definitely have an impact on your sexual function as well. Of course, your environment plays a role, the people you're with, so your partner, your relationship. So it's not just, at the moment function sort of thing. It's a build-up that is incorporating holistic, sort of influence. And of that, then, of course, you have your hormones, and the hormones that often come into play include your testosterone, which determines maybe your sexual need and, your libido. But that is also influenced by many other hormones, like your oxytocin, which is, stimulated by hugging and intimacy, and then your, corticosteroid. So it's a host of different things, really.
Wow, that's certainly a lot of things going on in our body and in our mind. Well, Dr. Phil, as we encourage more men to take ED seriously, maybe we can start with how damaging is erectile dysfunction to our mental health?
So actually, mental disorders and erectile dysfunction have a huge link, between the two. Mental disorders can be causative for erectile dysfunction in about 10 to 20% of cases. And mental disorders can also be the result of erectile dysfunction. So there's two ways that can happen. It can be direct or indirect. So, for example, those with erectile dysfunction are known to have higher risk of developing mental health issues like low self-esteem and depression, and maybe even anxiety. And it can be indirect in the way that, people with low testosterone levels can actually have erectile dysfunction, and low testosterone levels can cause major depression as well. So, yeah, in fact, I recently had a patient who, due to a motor vehicle accident, had serious injury to his genitalia, and he had to remove both his testes. And, although he could continue with life normally in most other areas or domains, he was of considerable low mood and low self-esteem. And his wife described him as a changed man. She came to accept that he's unable to have any sexual libido or desire or erection, but he has become resigned and, remorsed and having, all the symptoms of major depression.
Yeah.
So that's a typical example of what can happen in people who have erectile dysfunction leading to mental health problems.
Yes, physical damage and accidents, like the case you mentioned, is a high risk for erectile dysfunction. But Dr. Phil, what are the other common causes and those related to psychological issues?
Age can also be a factor for why people develop erectile dysfunction. Our hormones start to, reduce. Our functionality also reduces. So there's a degeneration in most activities. There are psychological factors that cause ED as well, and that can be, things that stem even from childhood. For example, childhood abuse or sexual abuse. But that's not as common as maybe things that are in the present, like stress. So stress can be, job related, money related, or even marital. There can be, marital issues. It can be anxiety. So once a man experiences erectile dysfunction, he may actually be overly worried that the problem will happen again. So he has this anticipatory anxiety. And this can lead to performance anxiety or fear of sexual failure. And this is a vicious cycle. It consistently then leads to, erectile dysfunction. Guilt is another factor. The man may actually feel guilty that he's not satisfying his partner, and that, as I mentioned, 70% of sex is from the main organ, which is the brain. And so if that's playing in the mind, then it's definitely going to interfere with his ability to, maintain or have an erection as well. Depression is a common cause of erectile dysfunction. In fact, depression affects a person physically and psychologically. It can cause ED when a man is completely comfortable in sexual situations. So sometimes even drugs that are used to treat depression may also trigger erectile dysfunction as well. So all these are things that need to be explored. There is also low self-esteem. And this could be due to prior episodes of erectile dysfunction. There's a feeling of inadequacy. It can be a result of other issues unrelated to sexual performance. So low self-esteem can also be an influence. And sometimes it can be a matter of indifference. It may come as a result of age and subsequent loss of interest in sex, and also maybe the result of numerous other medical conditions or medications, or even problems stemming from the couple's relationship issues. So yeah, all men at one time or another may experience erectile dysfunction. If the problem is persistent, then that means it occurs more than half the time, or it becomes a source of distress for you or your partner. Then you should be concerned, and then you should be looking for medical advice and assessment and treatment.
Well, I guess, Dr. Phil, the problem is it's hard to tell when it's a persistent problem or when we are going through a phase of maybe stress with work or relationship. What about for those times when it seems like a one-off, failing to get it hard? Would that be a concern?
So very often, if it's a one-off, it may not actually be a dysfunction. Dysfunction means it's a disorder. That means it's a continuous problem. So the occasional one-off may be actually compatible with normality, normal life, because we go through emotional stress and anxiety, and all of this can actually have an influence as well. But if it's actually becoming more frequent and also then interfering with your relationship, it's interfering with your partner's, quality of sexual relationship, and then it is a disorder that needs to be addressed.
Well, Dr. Phil, we'll let you take that call in case it's something important. But for our viewers and listeners, stick around because we're going to talk about porn next with Dr. Phil. And maybe it's a good time for me to mention about the Men's Health Pledge that we have on our website at manupmalaysia.com. Now, Man Up Malaysia is not just about creating awareness about men's health issues. We also want to encourage men to take one step at a time to be healthier. So download the pledge at our website and pledge to do one thing better to improve your health and stay committed to it. And when you're done with that, you can download another pledge. Let's just improve our health one pledge at a time. Alright, Dr. Phil is back with us and we're going to talk about porn. Now, Dr. Phil, does porn help men with ED, or does pornography actually cause erectile dysfunction?
While erectile dysfunction usually mostly affects older men, A study conducted in Italy found that an increase in internet pornography viewing among teenage boys can actually cause sexual anorexia or pathological loss of appetite for romantic sexual interactions, and that then will lead to erectile dysfunction. But studies have been done following that, and they've somewhat debunked the theory, but have acknowledged that it may not actually help, especially if it's in excess.
Hmm.
So, it can influence a man's sexual appetite, but in excess, it can actually reduce that appetite. This can make it difficult for them to achieve an erection or even have an orgasm with a sexual partner. Another factor is pornography can create unrealistic expectations of what sex should look like and what your partner should look like or able to do. Because it's all acting, and for lots of men, uh, pornography can then engender shame if they feel they're not living up to the standards of an actor. The actor is, maybe has erection, after a few seconds again. And so in the end, I think it's about a balance, and avoiding overindulgence is definitely, important in ensuring good sexual function.
Well, that's our first key takeaway from this episode. For viewers and listeners, don't set yourself up for unrealistic expectations by taking the cue from the porn actors. Now, Dr. Phil, what would you recommend for treatment in terms of therapy?
Well, I would like to suggest that the first point of call for any sexual dysfunction, after all the medical causes have been excluded, of course, is you with a therapist, with a sex therapist. Sex therapy would be useful for treating erectile dysfunction, if especially if a man is able to have a normal erection during sleep, which then suggests that it's not a physical problem, it's more of a psychological problem. Sex therapy may also be helpful when erectile dysfunction is caused by stress, if it's resulting from work or worries or financial worries, or relationship issues. So, looking at therapy for relationships, and maybe even poor sexual communication. In these cases, especially sex therapy may be the best treatment option. The problem is we often look at a quick fix, and when that happens, it may help for that moment, but then it becomes a new norm, and you never resolve the real underlying issue. And that real underlying issue may not just be causing a sexual dysfunction, it may be causing a multitude of other issues in your life. Intimacy problems, relationship issues, even quality of work. You're actually sweeping everything else under the carpet just for that one blue pill to help with that moment. So yeah, so I would think it's best to treat it holistically.
Well, that's another good takeaway from Dr. Phil. Don't just treat the symptoms, but also treat it holistically. Maybe it's something psychological. Now, Dr. Phil, I'm not speaking for everyone, but I personally don't know a sex therapist. How do we find a sex therapist in Malaysia? Or could we go to a psychologist or a psychiatrist?
Yeah, so among psychiatrists, I know I have a colleague who's actually done his subspecialty in sexual disorders and sex therapy. But most psychiatrists have been trained in managing the common sex disorders or dysfunctions. Clinical psychologists are also trained in dealing with this. And there are some clinical psychologists in Malaysia who have focused specifically on sex therapy and relationship counseling as well. So yeah, there are some therapists in Malaysia that are available to help with this area.
What about yourself, Dr. Phil? Have you seen many patients with ED?
Well, I personally haven't seen that many people with erectile dysfunction or sexual dysfunction. I may have had maybe about 10 or 15 cases throughout my career. And most of them, well, one, they were happy to know that, there was maybe a psychological thing that could be attended to, and, sort of help with their progress and improvement. But very often in sex therapy, we require the partner also to be involved in the therapy sessions. And that sometimes I find a challenge because there's still a lot of taboo, prejudice, and stigma about discussing these things. And when we do get the partner involved, though, I think we find actually better outcomes. So there have been actually some positive outcomes in some of the cases that I've managed, especially when the partner was involved.
Another good advice there from Dr. Phil: if you're going to see a therapist to treat your erectile dysfunction, bring your partner along, because it's not just an individual problem, it also affects your partner or your spouse. So another good takeaway there from Dr. Phil. Doc, what would your advice be for men who's experiencing erectile dysfunction, struggling with their relationship in the bedroom, and also struggling to deal with it when it's just not happening during sex?
Well, I think the first important thing is to identify that sexual dysfunction does not mean relationship destruction. We cannot correlate the two. Intimacy does not necessarily only have to be sexual function. It can be even the touch, the hug, the bonding together. So maintaining intimacy is just as important as having a good sexual relationship. And then having open communication about your sexual function, discussing with your partner that these are things that are causing some anxiety for you, and you want to know what your partner feels and thinks about it. And then you want to look at, okay, what can we do to assess and do your own audit. Identify, are there recent things that have happened in your life that may be triggering this? Are there some medical problems that you need to attend to? Who do you go and see to just rule out some of the more common medical causes for this? And then if it's not a medical problem, okay, who can I see then to address the psychological factors? I think you deserve to identify and look at what can be changed and modified in your own life as well.
And Dr. Phil, before I let you go, maybe you can talk a bit about encouraging men to come forward, to man up, to seek help, to seek treatment, whether physical or psychological, and not to just suffer in silence and resort to temporary fixes like pills.
Yeah. Well, I mean, I think the sad thing is, we have these blue pills and everything, which actually by right are meant to be prescribed, not over the counter, not bought without seeing someone. And ideally, it should be with a discussion. And that can be your first point of call, where maybe you meet a doctor who's able to prescribe these, and then discuss the issues that you currently have. Just being able to ventilate sometimes reduces the stress, and then the doctor can point you in the right direction. That maybe you need to address this more longitudinally, not just fix it. Sort of put a band-aid on it and pretend that it's not going to come back. So yeah, I think that's one. The other is there's no embarrassment in actually talking about our human body and about our function to especially healthcare professionals. We are trained to be respectful about everything that patients talk to us about, and confidential in what we deal with as well. So, if you can't trust a doctor, then who are you going to talk to about these things, right? I mean, you want to keep it in yourself and, take it to your grave. I think it's of no purpose. So I think men need to break that boundary and feel more comfortable discussing things that are affecting them, especially.
Thank you very much, Dr. Philip George, consultant psychiatrist and addiction specialist, on shedding some light about erectile dysfunction and our mental health. Thank you, and we hope, Doctor, you'll come on our next show sometime soon. All right?
All right. Thank you. Thank you for having me.
That's Dr. Philip George, consultant psychiatrist and addiction specialist, as we covered the link between mental health and erectile dysfunction. But there's another angle that I want to cover, which is the relationship between men with ED and their partner or spouse. And for that, I spoke to a relationship counselor.
In a marriage or in a relationship, it is very damaging. I think if you don't talk about it, I believe that it can lead to a breaking point. And to have a healthy sex life, the one thing that is most fundamental is communication.
So tune into our next episode as I talk to counseling psychologist and relationship counselor Sharon Koh on how to communicate about sexual problems to our partner and spouse. Like how do I tell them I have ED? All this in the next episode of Man Up Malaysia. But just before I go, let me remind you about the health pledge that we have on our website at manupmalaysia.com. Man Up Malaysia is not just about creating awareness about men's health issues, but we also want to encourage you to take one step at a time to improve your health. I'm Kevin Francis, and this is Man Up Malaysia, encouraging men to get healthier, one pledge at a time.